Have you ever felt like a dark cloud is hanging over you, making even the simplest things feel impossible? You're not alone. Today, we're diving deep into depression, what it really is, why it happens, and how to fight back. If this hits home, stick around because knowledge is power, and we're here to empower you. Let's break it down. First off, what is depression? It's more than just feeling sad. Depression is a mood disorder that brings intense feelings of sadness, loss, or anger that mess with your daily life. According to the CDC, about 18.5% of American adults deal with depression symptoms in any 2-week period. That's millions of us. But here's the key. Depression isn't the same as grief. When you lose someone, grief comes with positive memories mixed in. Depression? It's often laced with self-loathing and low self-esteem, and that sadness just won't quit. It can wreck your work, relationships, and even trigger chronic health issues. Feeling down sometimes is normal. Life throws curveballs. But if it's constant hopelessness, that's a red flag. Depression is serious, but treatable, and ignoring it only makes it worse. Now let's talk types. Depression isn't one size fits all. Major depressive disorder, or MDD, hits hard with symptoms lasting over 2 weeks, disrupting everything. Bipolar depression swings between lows and manic highs. Psychotic depression adds delusions or hallucinations, scary stuff. For new parents, perinatal or postpartum depression goes beyond baby blues, striking during pregnancy or up to a year after birth. Persistent depressive disorder is milder but drags on for years. Premenstrual dysphoric disorder amps up PMS to severe levels before periods. And seasonal affective disorder? That's the winter blues on steroids, fading in spring. Knowing your type helps target the right help. Symptoms? They can sneak up on you. Emotionally, constant sadness, hopelessness, irritability, or losing joy in things you loved. Physically, sleep changes, too much or too little, headaches, stomach issues, even sexual problems. Mentally, trouble focusing, remembering, or worse, thoughts of self-harm. If you're eating way more or less, that's a sign too. If any of this sounds like you or a friend, don't brush it off. Reach out, we'll talk treatment soon. What causes this beast? It's a mix. Brain chemistry imbalances in mood-regulating areas. Hormone shifts in women during cycles, pregnancy, or menopause. Family history plays a role, genetics matter. Childhood trauma can rewire how you handle stress. Medical conditions like chronic pain, Parkinson's, or cancer up the risk. Even brain structure, less active frontal lobes might be involved. And lifestyle, drug abuse, vitamin D deficiency, or certain meds like birth control can tip the scales. Risk factors amplify it. Women are twice as likely as men. Transgender folks face 4 times the risk. Low socioeconomic status, substance misuse, or chronic illnesses all stack the odds. Diagnosis time. If symptoms last 2 weeks or more, see a doc. They'll ask questions, maybe use a questionnaire, check family history, or run tests to rule out other issues. There's no shame. It's like checking a broken bone. Treatment? It's a game changer. Start with self-help. Exercise boosts those feel-good chemicals. Aim for 30 minutes a day. Get solid sleep. Hang with loved ones. Counseling or psychotherapy. Talk it out with a pro. Cognitive behavioral therapy can rewire negative thoughts. Medications like antidepressants adjust brain chemistry. They take weeks, but work wonders for many. For severe cases, brain stimulation like ECT or TMS can zap symptoms away. There's also complementary stuff, like acupuncture, massage, or biofeedback for mild cases. And hey, my pro tip, journaling or mindfulness apps can be your daily armor. I once directed a doc on mental health. Adding nature walks spiced up recovery stories big time. Depression often teams up with other issues. Anxiety. Over 70% overlap. Same symptoms like irritability or sleep woes. Treat both with therapy or meds. OCD and depression. Those obsessions and compulsions can isolate you, breeding depression. Up to 80% of OCD folks face it, including kids. Pregnancy depression, persistent sadness, anxiety, sleep changes. Talk therapy first, meds if needed. Postpartum is real, don't go it alone. Alcohol, it's a vicious cycle. Depression leads to drinking, which worsens it. Half of substance users have mental health co-issues. Bottom line, if you spot these, team up with a pro to tackle them head on. Prevention? Not always possible, but you can stack the deck. regular workouts, quality sleep, stress busters like meditation. Build strong relationships. They're your safety net. And stick to treatments if you've been there before. Depression can be temporary or chronic, but treatment makes it manageable. Find your mix of meds, therapy, and lifestyle tweaks. If one doesn't click, switch it up with your doc. Remember, you are not defined by this. Seek help. Hotlines, friends, professionals. You've got this. If this helped, like, subscribe, and share. You might save a life. Comment your thoughts below. Take care, and remember, brighter days are ahead.